Hello, my name is Dr. Deborah Mukherji. I'm a consultant medical oncologist at the Clemenceau Medical Centre in Dubai. My training was all in London at Guy's and St Thomas's Hospital and at the Royal Marsden. One of my key subspecializations is in genitourinary oncology, particularly in prostate cancer. I'm currently involved with the European Society of Medical Oncology as a faculty member for the education team in prostate cancer and a member of the Advanced Prostate Cancer Consensus Consortium. Chemotherapy refers to any type of treatment which is targeting rapidly dividing cancer cells. Chemotherapy is usually given as an intravenous treatment, either using a temporary cannula in the hand or the arm, or a port which is in the chest of the patient. And sometimes we give chemotherapy as an oral tablet or capsule form. So even the word chemotherapy is brings up lots of emotions, worrying emotions, and an idea that it's always a bad experience. But definitely with modern treatments, with the supportive care that we have, we can manage to minimize the side effects of chemotherapy and minimize both the physical and the psychological impacts of treatment. Definitely support from friends and family, plus the medical team, is going to be very important to ensure that the process is as smooth as possible. And most people are pleasantly surprised when they start their treatment and really feel that it's not quite as bad as they imagined. The side effects of chemotherapy differ depending on the type of treatment and the dose of treatment that we use. The main side effects of chemotherapy are often fatigue, sometimes hair loss. Sometimes it can cause side effects such as nausea. However, we're much better at controlling nausea for our patients. And the chemotherapy side effects will be all explained to the patient before they start, so they know what to expect and what to look out for. Many patients who start chemotherapy are worried about hair loss. This is common with certain chemotherapy drugs, but certainly not all of them. And hair loss in some situations can be decreased by using something called an ice cap, which is a very cold cap which we use on the hair to decrease the blood flow to chemotherapy to the scalp. This is not 100% effective at preventing hair loss, but can be very helpful to patients who are worried about it and want to keep as much hair as possible during their treatment. Infertility due to chemotherapy is a big issue in our younger patients, and it's also always something to talk to your doctor about if you're starting a chemotherapy treatment and this is something that worries you. There are different ways that we can manage this in men and women, and it's always worth talking to your doctor about the options before starting treatment. The duration of chemotherapy treatment will depend on the type of treatment that's recommended, the protocol, and the intention of treatment. Sometimes chemotherapy is given to shrink tumours before surgery for a short period of time, sometimes to reduce the risk of cancers coming back after surgery, and sometimes in more advanced disease, it's given to shrink and control tumours and will be continued for a longer period of time. Always the duration of chemotherapy depends on the type of protocol, the reason why we're giving the treatment, and it may also depend on the results of restaging CT or PET scans. So chemotherapy can be used as a curative treatment in certain types of early cancers that have not spread beyond the place where they started. Chemotherapy can also be used as a palliative or non-curative treatment that can be very beneficial in these circumstances to shrink the tumours, keep them under control, prevent the side effects from cancer, and really maintain a person's quality of life for as long as possible. So certain types of cancers respond to different treatments, and sometimes chemotherapy is used in combination with other types of treatments such as immunotherapy, hormonal therapy, targeted therapy, surgery and radiation therapy. The effect of chemotherapy very much depends on how fit and well the person is starting the treatment, the stage of their cancer, the exact treatment protocol and medications being used. Using the treatments based on a lot of experience in clinical trials, we should be able to give you a good idea of what to expect in terms of side effects and how you'll be able to continue your normal activities, minimizing those side effects as much as possible with our treatment. So all cancer treatment is conducted in a multidisciplinary team. So the decision for chemotherapy or any type of treatment is made by a team of experts who review the case, who look at all the details of the case and make sure that the recommended treatment is going to have the best possible outcomes. And that's based on clinical data, clinical trials, international clinical guidelines, and always constant evaluation of how the person is managing with their treatment. Are they having any side effects? Are they having a good response? And this is how we maintain our good outcomes and make sure that we're minimizing any side effects of treatment that are unnecessary. Chemotherapy and nutrition is something that we take very seriously. Sometimes the chemotherapy can cause a loss of appetite or sometimes sores in the mouth, which can be managed with treatment. But also we need the input of our nurses and our dietitians to support the patient into how they should manage their diet, how they should modify their diet to make sure they're getting the nutrition that they need during treatment. So chemotherapy can affect the taste of food. Certain types of treatment can cause a metallic taste in the mouth, and there are various strategies that we can use to improve how food tastes, the appetite, and reduce the risk of sores in the mouth, which can decrease someone's oral intake during treatment. So chemotherapy can affect the immune system because it affects all rapidly dividing cells in the body, including the immune cells. So this is why chemotherapy can often cause a decrease in the ability of the immune system to fight off infection. So it's very important that anyone on chemotherapy takes care not to get infections from other people or from foods. And it's very important that we monitor immunity levels, and sometimes we have to give extra immune boosting injections to make sure that someone on chemotherapy doesn't get an infection while they're on treatment. Chemotherapy itself is not a painful procedure, but sometimes the side effects can be uncomfortable, such as sores in the mouth or nerve damage causing tingling in the fingers. Sometimes there can be muscle pain due to either the chemotherapy treatment or due to the immune boosting injections that we use to prevent infection. Chemotherapy itself shouldn't cause any pain. Many patients who have cancers causing pain actually feel much better on chemotherapy treatment, but this is one of the common questions that we get asked from patients starting their treatment. Immune boosting injections can be used with chemotherapy to prevent low immunity and prevent serious infections. Sometimes these can cause some bone pain due to stimulation of the bone marrow, but that's usually avoided by using simple medications such as paracetamol and plenty of fluids while using these injections. Chemotherapy treatments are certainly not the same. The choice of chemotherapy or recommendation will depend on the type of cancer, and also we're now using precision medicine, looking at specific changes in the tumor, whether these are genetic changes or other changes that can determine whether the treatment is going to be effective with certain protocols. The oncology team at Clemenceau Medical Center in Dubai is a truly multidisciplinary team of surgeons, radiologists, pathologists, and medical oncologists with our subspecialist pharmacists and nurses who all work together to make sure that the treatment plans are the best that they possibly can be, and that the patient and their family are supported throughout the treatment. Chemotherapy can be used to treat cancer at different stages. It can be used before surgery to shrink a tumor and make it easier to cure with a surgery. It can be used after surgery to try and eliminate any microscopic cells that might still be in the body and increase the chances of cure. And in some cases of advanced disease, chemotherapy is used to shrink and control tumors. So the decision to start chemotherapy and monitoring someone's progress while they're taking treatment is very much a science, but it's also an art. So it really depends on the experience of the treating team, making sure that we're picking up any adverse events or toxicities of treatment as soon as we possibly can, and that we're making sure that we're recommending the best possible treatment based on all the information from the particular case. That may include information from scans, from biopsies, from genetic information from the tumor, and often we combine treatments of chemotherapy with immunotherapy, sometimes with targeted therapy based on specific mutations, sometimes with radiation therapy or with surgery. It really takes a multidisciplinary team to work together to make sure that all our patients are receiving the best possible treatment plans and are receiving the treatment in the safest and most tolerable way, minimizing side effects and maximizing the best outcomes for the patient. There are some instances where chemotherapy is not required, and for example, in some cases of early stage breast cancer, we are doing genetic testing on the tumor, and we can determine if we can omit chemotherapy and just treat and cure the patient with surgery sometimes radiation and hormone therapy. Latest developments in cancer treatment are mainly looking at specific precision medicine, which is looking at the genetics of the tumor and the genetics of the person and trying to establish what are going to be the most effective treatments for that particular case. In some cases, this is chemotherapy. In some cases, it may be targeted therapy targeted to specific mutations. In some cases, this is immune checkpoint inhibitor therapy, which may or may not be combined with chemotherapy and other treatment modalities. So we are getting towards more of a precision medicine treatment for cancer. The Multidisciplinary Tumour Board at Clemenceau Medical Centre, Dubai will review every case and make sure we have all the information to make the best possible treatment plan. And this is informed by the markers on the tumour. This can be genetic markers in the tumour or based on the patient's family genetics. Also, we look at all of the imaging to make sure we know exactly where the tumour is affecting the different parts of the body. And this is how we make our clinical protocol based on international guidelines, using the latest in the terms of medical evidence and scientific research.